这病也不是咋回事啊？给闺女的腿。
Chikungunya fever outbreaks have occurred in multiple locations across Guangdong, with Foshan, where the outbreak was first detected, being the hardest hit. Online reports suggest that Foshan is currently experiencing a recurrence of COVID-19 style restrictions, including nucleic acid testing, travel registration, quarantine, and blood draws. Those who refuse to comply reportedly face fines and power shutoffs. Foshan is implementing nucleic acid testing, quarantine, and blood draws. Those who refuse face fines and electricity cutoffs. According to online reports dated July 29th, nucleic acid testing has resurfaced in Foshan, Guangdong, due to the Chikungunya fever outbreak. Community testing sites have quietly reappeared. Quarantine orders have been issued, and residents who refuse testing risk having their power cut. Blood draws have even been added as part of the screening process. The remnants of the 3-year COVID-19 response are re-emerging. To prevent the spread of chikungunya and dengue fever, Foshan is conducting a comprehensive blanket inspection and cleanup. Strong measures such as power shutoffs and fines are being taken against individuals or landlords who resist inspections or delay rectification. Recently, many rental property owners have refused to cooperate with epidemic control efforts, denied access to inspectors, and failed to make necessary changes, leading to electricity being cut off in their rental units. In response, netizen Blaze commended Dubai nucleic acid testing, quarantine centers, community lockdowns, using QR codes to control movement, power outages, and even forced entry have become muscle memory for the authorities. People may forget, but for the CCP, this has become a set of SOPs. If there's no resistance or only minimal resistance, it can be suppressed. It's a viable and sustainable approach. Are there police stationed at the quarantine sites in Foshan? According to the official Xinhua news agency, on July 29th, the Foshan municipal government, based on the relevant emergency response plan for public health events and considering the current chikungunya fever situation, decided to initiate a Level 3 public health emergency response. The outbreak in Foshan is severe. A local netizen currently under quarantine shared that they were on their 4th day of isolation due to chikungunya fever. My joints no longer hurt, the fever is gone, I've taken Chinese medicine, and 2 days blood test came back negative. A negative nucleic acid test allows discharge. Medical staff and safety inspectors are working around the clock to fully contain the virus. Videos show that rooms in the suspected isolation hospital are already full, with mosquito nets covering each bed. Multiple police officers are also seen in the lobby. A Guangdong netizen remarked that when the number of cases was low, quarantine was free, but as the situation worsened, patients were required to pay out of pocket. The epidemic in Guangzhou is also severe, with cases reported in all 11 districts. According to China News Service, the Guangdong Provincial Centers for Disease Control and Prevention announced that from 00 on July 20th to 2400 on July 26th, a total of 2,940 new local cases of chikungunya fever were reported in the province. Among them, 20,882 were in Foshan, 22 in Guangzhou, and 10 in Zhongshan. The remaining cases were reported in Dongguan, Zhuhai, Heiwan, Jiangmen, Yangjiang, Zhaoqing, Qingyuan, Shenzhen, and Zhanjiang. It's worth noting that official CCP-released epidemic data is widely questioned for severely underreporting actual infection figures. While Beijing authorities have acknowledged only occasional imported cases, the Foshan outbreak has already spilled over into Macau. According to Dalian accounts such as Kankan News and Guangzhou Daily, Guangdong province has reported over 5,000 cases of chikungunya fever, and the entire city of Guangzhou has been classified as a medium-risk area. The risk of transmission remains in both Guangzhou and Foshan, though current cases are said to be mild. On July 30th, the Guangzhou Centers for Disease Control and Prevention reported mosquito-borne disease cases in all 11 districts. One Guangdong netizen commented, "It's true, all students in Guangzhou are on holiday now. I heard school won't reopen until September 1st. Mainland netizens expressed their concerns in the comment section. "Just got back from Guangzhou. I went to Baiyun Mountain. My legs are covered in bumps. When I scratched them, they turned yellow. It's been over a week, and they're still sore. My husband got itchy a month ago and now has a rash all over his body. These past few days, my whole body's been itching for no reason, and I've been scratching it all day long." It's not just Foshan, Guangzhou, Yangjiang, Zhanjiang, and even Macau have reported cases. The affected area is no longer small, and there's no specific treatment for the virus. The pain can be excruciating and severely affects daily life. In some places, people aren't allowed to leave until their test results are available. The Chikungunya outbreak in Foshan, Guangdong, is spreading rapidly. Beyond Beijing and Macau, it has already reached 12 cities in Guangdong province. While the CCP continues to conceal COVID outbreaks, it is now amplifying the Chikungunya outbreak in Foshan. Authorities have resumed mass testing, requiring residents to line up for blood tests, and launched a campaign-style mosquito eradication drive with a 7-day anti-mosquito operation. Overnight, Foshan has returned to the pandemic prevention mode of the COVID era, sparking panic among residents. Foshan is now killing mosquitoes like crazy. Drones are spraying insecticides more aggressively than the rain. Piles of dead mosquitoes are forming into small hills. People are questioning these extreme measures. Some areas where water accumulation is impossible are still being treated, clearly just for show. On wide roads, rainwater dries in half an hour, yet mosquito control operations continue. I don't even know what they're afraid of. People in Guangdong are now fully mobilized in the mosquito eradication effort. As chikungunya cases continue to rise, residents have gone all out in the anti-mosquito campaign, using physical, chemical, and biological methods. Mosquito nets aren't just inside homes, they're covering sewer openings. Every household is emptying containers and clearing standing water. Inside, people use mosquito coils. Outside, teams spray insecticides. Even sewer covers are being lifted and sprayed. In some areas, mosquito fish are being released into ponds to eat mosquito larvae and eggs. When the chikungunya virus emerged, what happened around me? Community committees and CDC workers went door-to-door checking for standing water in every household. My God, even the slightest puddle had to be removed. A plot of land at the community entrance, left untouched for 10 years, was flattened in just 2 days to prevent mosquito breeding. Weeds were pulled straight into the sewers. Residents in Foshan posted videos saying the response to the outbreak is excessive. For example, stagnant water has been sitting in front of the Dongping Square bus stop for months. Even after repeated complaints, no one has cleaned it. I reported it to the neighborhood committee just yesterday. They said they passed it on to the relevant departments, but still, no one came. The bus stop area is so flooded that the characters on the bus sign are completely covered. It's clear how long the water has been there. Many people park illegally in the area, and those waiting for buses are forced to stand in the middle of the road. Another campaign is about to begin. The anti-epidemic farce is unfolding once again. Authorities have mandated that all administrative villages and communities in the city clean up outdoor sanitary dead zones. Residents are required to overturn containers and eliminate any mosquito breeding sites. Inside homes, families must carry out mosquito extermination twice daily, in courtyards, balconies, rooftops, and other areas, once in the morning and once in the evening. In some villages, all crops and farming tools must be removed, and titanium dioxide must be cleared. Even barren land is not spared. This so-called decisive campaign requires households to implement a 7-day, 7-step method indoors. Light mosquito coils, hang mosquito nets, install mesh screens, remove stagnant water, clean up garbage, apply repellent before going out, and exterminate adult mosquitoes between 7 to 10 a.m. and 4 to 7 p.m. daily. These measures closely resemble the mosquito eradication campaigns during Mao Zedong's Four Pests campaign and have been labeled yet another absurd mass mobilization. Beginning on the last day of July, the city of Foshan launched a 7-day campaign to eliminate mosquito nests. 10 million households are required to light mosquito coils, hang nets, install mesh screens, remove stagnant water and garbage, apply repellent before leaving home, and kill adult mosquitoes morning and evening. Foshan residents have declared all-out war on mosquitoes. According to mainland Chinese media, Foshan has launched a citywide mosquito extermination campaign to prevent virus transmission. Local officials are inspecting homes for standing water, and for uncooperative residents, power outages have been used as punishment. Video footage shows the government deploying armed police to assist in mosquito eradication efforts. Some netizens commented, "The military is being mobilized. This feels serious." The epidemic prevention campaign in Shunde district has reached a fever pitch. Online sources indicate Shunde is urgently hiring disinfection workers due to a staffing shortage, offering salaries of 300 yuan per day. Others speculate that a lockdown may be imminent. Beijing has also reported imported cases of the Chikungunya virus. On July 22nd, the Beijing CDC confirmed the cases were caused by Aedes mosquitoes, commonly known as tiger mosquitoes. Parents have been urged to stay alert.